Hi, my name is Michelle Nguyen. I'm the Director of Dermatologic Surgery at Boston Medical Center and Tufts Medical Center in Boston, Massachusetts.
All right, first question. One of your colleagues presented research you both worked together on this weekend at the 2020 virtual ASDS meeting. Can you tell me a little bit about this research and what the presentation was about?
Dr. Jessica Auerman, a resident in dermatology at Tufts Medical Center, and I analyzed the nationwide Medicare payment system to identify all providers who perform Mohs micrographic surgery in the United States. And we found, similar to traditional surgical specialties, women account for only 30% of all practicing dermatologic surgeons in the United States currently. And the percentage of women surgeons have improved by only 3% between 2012 and 2017. When we look at the clinical practice pattern, we noted that nearly half of all group practice only had male surgeons in their group.
What are some key takeaways from this research?
The key takeaway is that even though women account for half of all practicing dermatologists and over 60% of all dermatology residents, we account for only 30% of practicing dermatologic surgeons. And the pace at which we're improving the women representation in dermatologic surgery has been very incrementally slow and small, less than 1% a year, which is unfortunately reflected in other traditional surgical specialties as well. The underrepresentation is true across all regions in the United States, although we do now have a women dermatologic surgeon in every single state and territory of the United States.
And my last question, what are some ways the dermatology industry can help increase female representation, especially within the surgical sphere?
I think to increase the number of women dermatologic surgeons in the United States, we first need to figure out why more female residents are not choosing to do specialty training in dermatologic surgery. It could be because of additional years of training, a perceived more restricted job opportunities, work-life balance, lack of mentorship, any or all of the above. We just won't know until we ask our residents and trainees what influenced their decisions. And we as dermatologic surgeons could also consider being more open to our trainees and students about our experience during training and in practice, so that the trainees have a better perspective and make an informed decision about whether or not a surgical specialty is the right choice for them.